So today's topic, obstetric gynecology and homeopathy, what every homeopath must know. Again, this is a very unique topic, but by core, this forms the foundation of Dr. MLW Memorial Trust Hospital, from where Dr. Chetana has done her residency. She has worked there extensively, and even before that, she has worked in this field of OBGY. Now, where has this work gone? To the extent that she has done a dissertation on that. So her experience in this particular field before joining her MD and during her MD period, and about the dissertation that she has done. So we will learn all of this from her experience comprehensively today in this podcast. About Dr. Chetana, one thing I will tell you is, there is a saying that if you want your work done from someone, give it to the busiest person. And practically, she is one of the busiest person at MLD MHI. And she's working with the Department of Repertory. She's doing her NAC work, and there are a couple of other works which even I don't know she's doing, but I keep seeing her working all the time. And despite of that busy schedule, she has been preparing for this podcast, and she has come live with us today. So Dr. Chetana, we would love to hear about this topic of OBGY and homeopathy, what every homeopath must know. So what are your thoughts on that?
So first of all, thank you, Dr. Kaur, for this warm introduction. Okay, so if you look at the topic, this ops, gynec, and what every homeopath should know. So these two are the vast branches, obstetrics and gynecology. So better we should start with the ops first, because from that we can continue further to the gynecology. Yeah.
Okay, so we'll start the session with obstetrics. I think that would be a better option to do, as you have suggested. So, what is the scope of homeopathy in the field of obstetrics? Because we all know that obstetrics is a branch that deals with pregnancy, childbirth, postpartum, including care of the newborn. So, what is that as a homeopath we can do in this, and what kind of knowledge we should have to deal with this field?
So, as you rightly said, the ops deals with the pregnancy, childbirth, and post-pregnancy things, including the care of a child. So, if a homeopath wants to practice in this field, so first he should have the knowledge starting from the trimester, all the condition arising in each trimester, then a condition arising in the parturations, that is during the time of delivery, and at the time of puerperium, that is the 6 weeks after the delivery. So if we say, for example, in the first trimester, what are the commonest conditions that we can deal? That is hyperemesis gravidum is there, PV bleeding, PV discharges, that can occur in the first trimester. Abdominal pain can be there. So it's not that we should have the knowledge of symptoms, that these are the symptoms that occur in the first trimester or second trimester like that, but we should also know the significance of it, because like we say, if abdominal pain is occurring in the first trimester, what are the probable things that we can think of? It can indicate ectopic pregnancy as well. It can indicate, if it is associated with PV bleeding, it can indicate miscarriage. And we need to think in that way, because if miscarriage is going to happen, then we should probably need to intervene, or we need to include other system of medicine as well in this. So we cannot manage this on OPD basis. Regarding if abdominal pain is occurring in the second trimester, then what are the conditions? See, it can also indicate preterm labor if it is occurring in the late second trimester, like 6th or 7th month. If it is occurring along with the PV bleeding, like in the first trimester, we say miscarriage can be occurred. So here, so we can think of miscarriage, but along with that, placenta previa, Broca's placenta like things we should consider. And likewise, we should have a proper knowledge along with its significance and what all the things that we can do in that as a homeopath, as a practitioner, and so that the patient can be benefited at fullest. There should not be danger to the life of patient. So in terms of homeopathy, if we speak, like we do have a scope of homeopathy in antenatal care, like what in ANC, hyperemesis gravidum we can easily deal with because it is the most commonest condition and females suffer a lot because of this condition as well. So homeopathy has a great scope in hyperemesis gravidum. Along with that, what we can offer as a homeopath to such person, see, we in homeopathy not only look for symptomatology of the patient, not only look for the present condition, but also we look for the past history of the patient and also the family history. So we are thinking, we are taking consideration of all the tendencies of the patient. So if the patient has tendency to abortion, that we can easily deal with. If the patient has tendency to hyperemesis gravidum, that we can deal. Hyperemesis gravidum is excessive vomiting during pregnancy, like, for example, just for clarification. So these are the tendencies that we can easily deal with. Then what else we can think of is other comorbidities. If the patient is presented with the other comorbidities like asthma, anemia is there, along with the ANC, during the time of ANC. So we can manage those conditions better with the homeopathic medicine. So this is the scope in ANC that we speak. But I would like to mention the special mention here. Like what happens is in ANC, a mother is provided with the supplementation like iron, folic acid, calcium. At any cost, we should not stop those supplementation because they are mandatory. They are mandatory for the growth of child because it can, if folic acid is not given, it can affect neurological development of the child as well. So at any cost, we cannot substitute homeopathic medicines with this. Like we have to continue the course of this supplementation during ANC care. Then during the time of labor, what are the like conditions like non-progressive labor, delayed labor is there, rigid os is there. So in such condition, homeopathic medicines works better. Even I think in the last reel on the dissertations in the repertory department, I do have mentioned this as well because it is my favorite dissertation as well. So in that, this student of repertory department have used this emergency Couch's emergency manual by Dr. Yingling, and she has actually worked in the ops department during the labor and has helped around 63% of the cases to with the homeopathic medicines. Yeah, so that is that indicates that we do have role in the active labor as well during the labor if the labor is non-progressive, if it is delayed, like that. Because and what is important in this as well, if a homeopath is and obstetricians is working hand in hand together, we can do wonder in this obstetric field because obviously it is a branch of medicine which any emergency condition can come up with at any time. We definitely need IPD setup for this as well. So for the benefit of community, if this happens, this ops and homeopath, obstetrician and homeopath can work together, it can be a revolutionary movement. Yeah. And in the postpartum phase, in the postpartum also, during the 6 weeks after delivery, that phase, a female can experience many conditions starting from the commonness agalactorrhea. Some may cannot lactate properly. There may be decreased secretion of lactation as well. So in such cases, we do have medicine. We do have rubrics for that as well in the Kent repertory in BVCR. In Kent repertory, it is like in chest milk absent or chest milk decrease, like that. We do have medicine for that as well. Along with that, if a female is suffering from postpartum depression or psychosis, we can take a totality and prescribe on the basis of that. Female do develop anxiety for child and they do not have proper orientation. So as a homeopath, as a practitioner, one should have a proper knowledge how to deal with the anxiety of the mother as well. You know, if you are dealing with the anxiety of other person, first of all you have to deal with the anxiety of your own. And how can you deal with that? With the proper knowledge of that particular subject. If you can easily guide mother that this is normal and this is abnormal, if you are able to say that because of your knowledge, then it can obviously benefit the patient as well. Yeah.
Oh, fantastic.
Also,
I mean, if all of you who are listening, if you feel that there should be a separate MD in OBGY and homeopathy, please give a thumbs up. It seems, Dr. Chetna, that this is a subject in itself for MD. That is the first thought which I got from what you have just described. Also, there is a lot of responsibility involved, a lot of reading, knowledge, tackling
definitely.
human life. And it's not just one, this time it is 2 human lives which are involved when we are treating OBGY. So definitely, and then the third part was, joining hands with an obstetrician. Because
Yeah.
you need the hospital. There are things which we can only do in the hospital. But if both the obstetrician and the homeopath can work together, I mean, it can create wonders. Fantastic. So, okay, we'll go to the next question. Now, we'll take up gynecology, the subject of
Yeah.
gynecology. And what is the commonest gynecological conditions that are reported to a homeopath? I'm asking specifically you because you are a homeopath and in this particular field. So, what is that you have seen?
So in the OPD, homeopathic OPD, especially if we come in, we have got an exposure from simple dysmenorrhea to various menstrual irregularities in even menopausal syndrome and even menstrual irregularity arising due to uterine fibroid or any other condition like that, endometriosis, etc. And even the most common is PCOS, infertility, and fibroadenoma of the breast. These are the most commonest gynecological condition that are presented to OPD, homeopathic OPD especially. Yeah, because that's it.
So, those who are attending and if you are into practice, give a thumbs up if you agree to what Dr. Chetna said. And if you are also seeing these kind of patients commonly in your practice. In the meantime, to the next question, what should be the approach while dealing with gynae cases? Now, when I'm asking about approaches, probably from a homeopathic point of view, but you could share your thoughts because, like I said, you are into that specialty. So, what does it
Yeah.
take?
So first thing is when you say approach, a clinical diagnosis must be very, very clear in our mind. And to reach the clinical diagnosis, we should follow all the steps from history taking to clinical examination to ordering proper investigations. The role of investigation, I'll definitely come to that point later, where we can utilize in the our field as well, from homeopathic point of view as well. But clinically, we should be very clear what we are dealing with, what is the scope of this, what is the scope of us in this, whether we are able to give proper cure to this patient or there is need of any surgical intervention like that. So we should be very clear with that. Many a times what happens, patient already comes with the diagnosed condition. In such cases, we do get easy ready report available. But still, if the patient is coming to you for the first time, you should know the proper guidelines to reach to the diagnosis. So that is the thing from clinical side. And from homeopathic point of view, see, what I think is homeopathy is so gentle. We deal with not only with the physical complaint of the patient, we take account of this mind, this mental picture. And we do not only limit ourselves with the use of mind for the level of counseling. I mean, yeah, what happens usually is the patient comes with the complaints of some, if patient is experiencing some agony and is expressed to any doctor, what any other doctor, not homeopath, what any other doctor can do is the counsel patient how to deal with the anxiety, or he can prescribe some anti-anxiety pill per se. But in homeopathy, we do go behind much more deeper than this. We do consider a psychosomatic correlation of the patient. We try to make an effort to establish that correlation, because we know what exactly goes behind the disease, not just the disease itself. So, along with the counseling, we take help of this psychosomatic correlation in the prescription of the remedy, final remedy as well. So here I think homeopathy differs from other medicine, where other medicines take help of such symptoms for counseling, for direct prescribing. But here we take account of this for, prescribing medicine as well. So and why homeopathy has a scope a lot in this female complaint, because all these complaints, many of these complaints arise due to imbalance in hypothalamo-pituitary axis. Hypothalamo-pituitary axis, this hypothalamus controls many functions including the emotions. Female which are more subject to emotional disturbances, because of this they experience this hormonal roller coaster in an entire month. Because of this menstrual cycle, there is obviously hormonal roller coaster which affects the emotion of the patient, which in turn can cause imbalance in the hypothalamus pituitary axis. If that stress, if that emotional disturbance is not taken well care of, then it can result in stress leading to development of such diseases. So we, as a homeopath, we do consider all these things, not only limited to the physical signs and symptoms. So if you have a clear picture available, clear mental picture including the causative emotional modality, or proper emotional intellectual signs and symptoms, along with the physical symptoms, we can take help of Kantian approach in this. It is more suitable approach for to treat such use this in this case. So yeah, but what happens in some cases, we may or we may not get proper mental picture, or some patients may not reveal their emotional sphere to us. So in this case as well, or even if we do have ample amount of, sometimes it happens, especially in case of beginners, that we do have ample amount of emotional, ample amount of mental symptoms, but what happens is we do get confused in very close coming remedies. We like see, for example, anxiety is there in this remedy as well. It is there in other as remedy as well. And if we cannot go to the qualitative level of anxiety, so we get confused what we can, how we can reach to the final prescription. So in such conditions, we can take help of investigations. See, for the final differentiation, we can use a seat of disease pathology which is going on for the final prescription. For example, if we are dealing with the menstrual irregularities and the cause behind is uterine fibroid, so definitely we need to think of the remedies which has action on the uterus and has a tendency to develop tumor, fibroid. So along with the symptomatology, we are thinking of these aspect as well. If the menstrual irregularities are arising due to PCOS, that is polycystic ovarian syndrome, in such cases we need to think of remedy which has action on ovary, and along with that has a tendency to produce a cyst. Likewise, and if this cause is more, if we are dealing with the case of infertility can have a cause of uterine fibroid, PCOS, like that. But if we are if we have a central cause, Like if there is that we can, you know, come to, we can easily understand this through investigations only. So investigations play a lot of role in terms of diagnosis, clinical diagnosis as well, and also in terms in final prescription. So these are important for homeopath as well. So every homeopath should be very well versed with the investigation. What are they? What is the significance of this? And that way we can utilize this investigation for the final prescription as well. Yeah.
Okay, so from this what I understand is that I mean, especially the point where those who are practicing in areas where patients come to the homeopathy, let's say the rural area, where they come to the homeopathy first time, don't even go to the gynecologist probably. That is where these investigations come handy. That if we know about them, and even they do not talk much. They have got some symptoms. We have the investigations, and like you said that we can use the seat of action of the remedy and utilize that. So that is something which I find quite helpful in this particular instance.
Yeah.
So any books that you can recommend in repertory, materia medica for reference in gynae cases?
So, like I said, Kane repertory, BBCR, these are very much helpful. Synthesis being modern repertory consists of various rubrics related to menstruation, related to OBS as well, abortion, tendency to abortion, things that the rubrics are there. And there are some clinical regional repertories. I mean, I have worked on Winton, so I will definitely share this. But this clinical regional repertory, though they are, old and not that much used, not that much used in the current era, but still, though they have less number of remedies, still they are useful in the current era as well. So we can take help of that as well. In the Kane repertory, like I said, this in Kane repertory, in the chapter of female genitalia, we will get different type of rubrics related to menses, related to abortion, like that, and other symptoms like hyperemesis gravidum. Other rubrics like for hyperemesis gravidum, it is segregated because the plan and construction of Kent repertory is from according to Hahnemann's schema from mind, then head to generalities. So in stomach, vomiting during pregnancy, like that we will get. And in BBCR, there is a separate chapter on menstruation, and various types of concomitants are available before, during menses. Even in Minton's repertory, why this is useful? Because in Minton's, they have given special chapters because it is a regional repertory. It specifically deals with these topics only. So menstruation, they have given time and quantity of the discharge. In the then character of discharge is available. Character of discharge in abortion, then they have separate section for this, like that. So these are some useful books, I think, that we can use in such conditions.
Dr. Chetana, you mentioned about the construct of the repertory, the logic of the repertory. I mean, so then we are going a step beyond ObGyn now, in the sense that we must also know that how that repertory is actually helpful in ObGyn cases. Only then probably we'll be able to help the patient in a more efficient way. And the audience, tell me if you are inspired to take up repertory as an MD subject, and no better place than NHI for that.
Definitely.
Chetana is a living proof.
Okay. So
yeah.
Should I share one case or what?
Sure. If the audience is all in for it, definitely.
Okay. So if I'll take example of simple Kate repertory because it is most useful and people are more well oriented with it. So in Kent, first of all, if we look at the approach of homeopathic case, taking consideration of all the signs and symptoms, including a mental picture. So in Canterbury, we have a mind section which is very well reached in the symptoms of positive emotional modalities. Like for example, elements from disappointment, elements from grief, elements from suppressed anger, then other anxiety related rubrics are there, fear related rubrics are very much there. So from mind part, these symptoms are there. Then to particular in Kent repertory, you won't get a separate chapter for menstruation. In female genitalia only, they have started menses as a main rubric. So in that, some symptoms in that, for example, rubrics like if you this is one different aspect that for menorrhagia we don't have any special rubric. For that we need to consider a rubric menses copious. This is a different thing in Kent repertory. Otherwise, all other rubrics like menses protracted for longer duration if it is there, menses absent for amenorrhea without pregnancy, of course, these are there. These rubrics are there. So all these rubrics we can utilize for solving the cases. And for abortion, I think tendency for abortion, then abortion related like discharges. If the character of the discharge is dark, red, or black, like that, we do have specific rubrics for that as well. And I think one more thing is if abortion is occurring in the specific month, if the tendency of abortion is there in the first month, if it is in second month, if it is third month, then other the different rubrics are there. It is not that only abortion, but month wise they have given separate rubrics as well. So,
wow, I mean, a little bit longer, and this will turn into a repertory masterclass, and we would love to have one from Dr. Chetana on another podcast. So, Dr. Chetana, now with all of this, we would now like to know about your dissertation on menstrual irregularities. So, if you can name some remedies and also tell us something about how was this dissertation and what kind of preparation was needed.
I have done dissertation on menstrual irregularities where I have compared Kent repertory with the Minton uterine therapeutics. So from that, I came across from practical point of view, I came across with the list of remedies that are very much useful in certain conditions. Like for example, in menorrhagia, if we are treating on the OPD basis, we need to, if it is menorrhagia, that is excessive vaginal bleeding due to any cause, be it any cause, if it is there, we need to address this patient on urgent basis, obviously. So in such conditions, I have seen remedies like sabina, phosphorus, millefolium, then Thalapsi bursa pasteuris, which are very much useful in treating such cases. Even Thalapsi bursa pasteuris is given in mother tincture format, which work really well and help the patient very nicely. And the patient was really better in like 2 or 3 days, like that. So this is a practical example from my dissertation. Other things are there, like literary work was there. So I think this is not a platform to share that literary work. So
no, but I'll tell this to you because both of us are alumni of MLT MHI. There is a lot of solid work that goes in for dissertation, right? Starting from building your topic to the review of literature and then identifying cases and at the end of it, when that finally that dissertation is over and goes for print, I don't know what is that feeling, whether it is a sigh of relief or a pride that you feel, because you put in hours and hours of work, not just in writing and typing documentation, but also in seeing patients. It changes the lives of patients, it changes your life, and for better, trust me. I mean, that is an experience which every one of us, should have once in a lifetime. And as MLT MHI alumni, we are very fortunate to have that experience with us.
Definitely.
So we are nearing the end of this live session. So Dr. Chetana, any clinical tips for budding homeopaths? I will consider myself a budding homeopath because I have very little experience in ObGyn. So any particular tips?
I am budding as well. So this is what the clinical tips that what I do myself for the study of the topic, and even to keep updating with the knowledge. We do read the traditional books, traditional per se, the books which are asked, the like Kane Repertory, Kane Matra Medica, like the that books are there obviously, but what I would like to share is definitely we need to keep updated with the recent advancement which are occurring in the medical field, and which are possible through reading journals, and through online material which is available. From that we can keep update ourselves with the latest latest procedures which are there, and which are obviously very much useful. And along with that, I would like to share is for the starting purpose, what happens, we try to go for constitutional remedy. See, if we at initial stage we may get, or we may not get, or we may get a partial simillimum. So for that purpose we need to have something in our hand till the time that constitutional remedy is working, or till the time that uh, result is going to achieve. But for till that time we should think of sector remedy, like acute remedies. And in this condition, in finding the sector remedies, such regional books or such this repertories are very much helpful. This is my point. And means my point is, if we are striving for constitutional remedy, but also keep in mind the acute remedies. If the patient comes to you with some acute exacerbation of the similar condition, then we should have something in our hand priorly. That is a concept.
So, as I understand, is it like, having some sort of a ready reckoner protocol kind of thing, like a type,
Yes.
for example, if these are the set of symptoms, so usually this is the indicated remedy.
Yeah, definitely.
Quite
We
useful
can
from
definitely do that.
so then it seems like it's quite
It is,
useful from study and reference point of view, and also maybe probably later on research. I don't know if that because it's
from
protocol based,
therapeutic point of view also we can use. Yeah.
right? Fantastic. So
Mm.
we'll take up some questions from the audience. I know the audience number has dropped because there was a glitch in that. Nonetheless,
Yes.
if whoever is viewing it right now, they can ask some questions, and later on, if you have any questions, please leave them in a comment. Dr. Chetana will be happy to take up those questions. We'll wait for a minute. We'll wait if we have anyone who has any questions so far. I do have a question that comes up in my mind.
Okay.
How much does what kind of a role does diet play in this whole
Oh, yes,
process?
definitely. It is a major role. Diet is a major factor, because since before the time a lady is trying to get pregnant, or lady is trying to get conceived. From that point only, she should think of proper diet and nutrition, because in ops as well, there are chances of developing anemia, because the nutrition gets divided in between mother and child. So obviously diet plays a major role in this. And even in case of PCOS, a PCOS is definitely a disease of what do we call it, lifestyle, because of lifestyle, it is developing nowadays. So in such cases we should definitely advise some changes in the diet depending on the weight or the dietary habits of the patient. So diet obviously plays major role in this. Yeah.
Okay.
Along with the homeopathic medicines, the accessory treatment, this diet, nutrition, counseling, these all things are mandatory, and every homeopath should have a knowledge of all these things, including the exercises. If the patient of PCOS is coming to you, you should obviously know some exercises, not only the name, but you should be able to tell why this exercise is important to you and when it is to be done like that. So that way we should have a proper knowledge of these things as well. That I actually missed. Thank you, Dr. Kayur, for reminding me.
Agreed. I mean, I remember in some of the cases in my practice, I used to actually, show patients that, haath aise karo, aise karo. It's better to tell them, unless they see how it is done, they will not be able to do it. And I think even
Even
probably taking help of physiotherapists, if there are any specialized kind of exercises,
yes,
especially
yes,
postpartum, it becomes very difficult with,
yes, yes,
irritation of pelvic
definitely.
muscles.
Yeah. Even postpartum things, the care of a baby,
Ah,
how a baby should be handled, that thing is there. Even breastfeeding, proper technique of breastfeeding, that we should know. We should be able to tell the patient that how the exact breastfeeding should be done, how a baby should be taken care of, like that. These things are common, but we skip in our day-to-day practice, that we forget to tell this to patient, and patient comes with some major problem due to such common mistakes. So in that, if we are orienting the patient prior hand, then that thing is definitely beneficial to both of us.
agreed, yes, yes.
Mhm.
So I guess no questions. I'm sure and I hope that all of us who listened to this have learned something new today. We'll apply that in practice. That is the purpose of the session, to reach out to people, to get the best out of the author, because they have really worked very hard on this subject and they prepare a lot before coming for the podcast. I really appreciate all of you coming together on a Sunday. And I
Yes,
will
thank
request all
you.
of you to spread the word about the MLD podcast, like we have had Dr. Chetana today in this specialty. We'll have more such speakers. Do tell us if you have any other topic in mind which you would like to listen, and we will try our level best to get those speakers to you. Until that, thank you, Dr. Chetana, for this time on a Sunday and for enlightening us with the nuances of OBGY and homeopathy.
Yeah.
Uh,
Thank you, Dr. Kayur, for giving this platform and opportunity.
Definitely, I think we would like to have a session with you on the technicalities of repertory sometime,
Yes, yes,
specific to the repertory.
yes, yes.
You are in that field as well, and you're working the department of repertory at MLD MHI.
Yes,
All
definitely
right.
we can do that. Sure.
Yeah, sure. All right. Thank you, Dr. Chetna, once again, and thank you all of you for listening to this podcast. Please share it with everyone. Tell your fellow students, tell your colleagues, and spread the word. Yeah. All right. Thank you so much.
Thank you. Thank you, sir. Thank you all.